So for our next speaker, we have a true scientist. Dr. Willard Ward Cates is President Emeritus with FHI 360. FHI 360 is one of the largest and most active nonprofit organizations in human development within field activities in more than 80 countries. And you are a scientist with years of experience in the field of biomedical affairs, HIV prevention research, and as principal investigator for several grants with USAID and Bill and Melinda Gates Foundation, and also at FHI 360. And I want to welcome you to speak about science and what science has to do with family planning. Thanks.
Well, thanks a million, Julia. And in the interest of time, I'm going to show, unlike what Kelly said with research being slow and costly, we are going to do away, this is getting very insecure, do away with all slides, which was sort of the first criteria for being a scientist, and talk directly to the issues that were the topic. And that is fertility intentions, unmet need, contraceptive choice, and the social good. Now, it's platitudinous to this group to talk about a rights-based family planning program, but the way it gets implemented scientifically and in the real world is with a very simple question to the woman that comes in at each time she has an opportunity within a health system. And that's, do you currently intend to get pregnant? And her answer to that question determines how the algorithm goes as to what services you provide. And if she says, no, I do not currently wish to get pregnant, and she is counseled on contraceptive services and what contraception is she using to prevent getting pregnant, and she says, I am not using any, then according to the Demographic and Health survey, she is categorized as having the unmet need, the second part of this talk. Now, the unmet need, most of you realize, is actually what we call in science the outcome variable to Family Planning 2020. The goal of Family Planning 2020 is to reduce unmet need for 120 million women by 2020. So that's number two. In order to do that, we have to increase the method mix of contraceptive choices, which means increasing at a population level. For an epidemiologic geek like me, it means the contraceptive prevalence rate has to increase. And probably even more importantly, by FP 2020, the distribution of contraceptive methods has to change. We have 15 methods actually now available according to the WHO chart. And those are now categorized by CDC and the authors of contraceptive technology into 3 tiers. And they're tiers that are the levels of effectiveness of the methods. And the top tiers are those that are sort of forgettable contraception, as my colleague David Grimes would say. Those that require relatively little daily or even 3-monthly or coitally dependent adherence. And it's those methods that are now, you're going to hear a lot about in this conference. Talk about gleams in the eye when we began this in Kampala 4 years ago. Now we have programs in all countries, this one especially, being given in a task-shifted way for WHO Tier 1 contraceptives, implants, and eventually IUDs. So that's the third issue. And then the fourth is social good. Now, the Gates and Kaiser Family Foundation have done recent surveys looking at the role of family planning and sort of popular support for family planning. And they found, as we all know, that family planning is not just an end to itself. It may seem that way with 3,000 of us at this conference, but it's not. It's only part, and you've heard this from all of our speakers today, of a way of ensuring global development, women's empowerment, the social good. So as we move toward the post-2015 goals, from Millennium Development Goals, which we've written about how family planning is essential to meeting all 8, not just the 3 health Millennium Development Goals. You wait. When we start having whatever let's just arbitrarily say, are 10 Sustainable Development Goals after 2015, we already have a jump start on how family planning has interacted in a multi-sector segments with agriculture, with economic development, and with microfinance and so on. And that's where we're coming from, and that's where the social good is, and that's where the innovation we've heard about today is. Thanks.
So please just stay here. We have a few questions for you.
Okay, we have one that came in from Wanja Mena. And the question is, what are other family planning methods for males other than condoms and vasectomies?
Withdrawal takes a lot of self-discipline, but it has been found in a population level to be very effective. For example, during the Depression in France, birth rates went way down, and the main method available in those times was withdrawal. So, and if done right, all of the other 12 methods that are primarily women-initiated can also be male-assisted. Male-assisted in terms of support, male-assisted in terms of recognizing what the woman's right is in that, and the couple's right in that particular choice, and making sure that she has an adequate supply on hand to meet their own fertility preferences.
Thank you.